Hello everyone. Today we are going to talk about breastfeeding with flat nipples. Women rarely think twice about the shape of their nipples until they are pregnant or when they start breastfeeding their baby. Have you ever wondered if your baby will find it hard to breastfeed because of flat or inverted nipples? If you have, you're not alone. However, this shouldn't be much of a problem since babies are supposed to feed on the breast and not the nipple. This basically means that when your baby is feeding, most of the areola should be in the mouth and not only the nipple. When is a flat nipple really flat? That may seem like a silly question, but it isn't. Not if you look at things from a breastfeeding perspective. We are not interested in what the nipple looks like when it's just hanging out there. We want to know what it does inside the baby's mouth. The problem with just looking is this: a nipple that looks flat at rest may be just fine once the baby latches, while another nipple that looks identical at rest may be more difficult for the baby to feed on. In order to know the difference, we do a pinch test. Place the thumb and forefinger on the areola about 2 to 3 centimeters behind the nipple and pinch. The nipple will do one of the three things. 1. Stand out. This nipple is elastic and baby should be able to feed from it very easily. Stay flat and not protrude. This is what true flat nipples look like. Pull inwards into the breast, forming a dent. This is an inverted nipple, and these are the most difficult ones to deal with. Fortunately, they tend to only be found in one breast rather than both. Here's a surprising thing: nipples are not really vital for breastfeeding. Babies breastfeed, they don't nipple feed. So the nipple isn't there for the baby to suck on. It's just there to help the baby suck on the breast. A nipple gives the baby something to aim at so that he knows where his mouth should go. It also stimulates the baby's suckling reflex by pushing against the roof of the mouth. The baby needs to feel something quite deep in their mouth to stimulate an effective suck, and the nipple usually stretches all the way back to the hard palate. So, how do we help a baby breastfeed from a flat or inverted nipple? Often, it is possible to loosen those adhesions that anchor a flat or inverted nipple. This will allow the nipple to stand out a bit more, which makes it easier for the baby to latch on and suckle effectively. Here are some things that you can do to help. During pregnancy, your body releases a lot of hormones that help your pelvis and other muscles and tendons to relax. Luckily, these hormones also seem to affect the nipples. About two-thirds of women who have flat or inverted nipples before pregnancy find that they have disappeared by the time that the baby is born. Flat and inverted nipples are also much less common in second-time moms. The Hoffman technique. If you want to increase your odds of success, you can do some nipple stretching exercises called Hoffman exercises. Bo- Place both of your thumbs on the areola right at the base of the nipple and gently pull the thumbs apart to stretch the base of the nipple. Do it in both directions. up, down, and sideways. Initially, do it twice a day and work up to 5 times a day. The research is not very clear that these exercises work, but some midwives have reported good results. Just be gentle. You don't want to overdo it and have cracked nipples even before your baby arrives. You also shouldn't fiddle with your nipples if you are at a high risk of premature labor, since it can help you bring on labor. You can continue with these exercises after your baby is born if you feel it is still necessary. Shaping the nipple to help the baby latch. The simplest thing you can do to help baby latch is to shape the nipple and areola when your baby is latching on. You simply place a thumb and forefinger about 3 to 5 centimeters behind the areola. Push your hand backwards towards your chest and squeeze to flatten the breast. One important note: be sure the flattening of the breast lies in the same direction as your baby's mouth. When baby opens his mouth to latch, pull him in close so that as much as possible of the areola goes into the mouth. You can release your fingers once baby has started suckling and he is firmly attached to the breast. This technique basically just helps baby to latch deeply and get a good mouthful of breast. As long as baby's mouth is full of breast, it's easy for him to suckle effectively. It really doesn't matter whether it's nipple or alveolar that it's lying against baby's tongue. This technique by itself is often enough to let a baby breastfeed from a flat nipple, but an inverted nipple may need a little bit more help. Pull out the nipple before feeds. The suction of a breast pump can help to draw out and elongate your nipples. You can do this before each feed and it's going to help with the latching. You can use a modified syringe and pull gently to draw out an inverted nipple. Take a large syringe and cut round near the tip where the nipple goes. Remove the syringe pump and insert it through the edge all the way in. Now, with the smooth rounded edge touching the nipple, start pulling the pump. As you pull gently, the nipple will also lengthen. There are also commercial nipple pulling devices available on the market. They work on a similar principle to the syringe gadget, they just cost an awful lot more. Nipple shields. If all else fails, a nipple shield may be a useful tool to help baby latch. If you do use a nipple shield, be sure to read the post on my blog, which will give you lots of info on how to use it and also how to prevent any negative effects. You should also enlist the help of a lactation consultant to help you monitor your milk supply to help transition you to feeding just at one breast. Thank you for watching. I hope you have learned how to breastfeed with flat nipples. Kindly subscribe.